Okay, hi Alan, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment now. It's a little bit of fraying in the cartilage on the condyle, but one thing to remember as you watch the video is things are magnified about 30 or 40 times on the screen. So something that may look big and ugly is actually often just millimeters in size. So the meniscus here so far looks pretty good. I'm just flushing a bunch of salt water through the knee as we go through. But that medial meniscus looks pretty good here, all the way to the back here, and I'm kind of probing it and putting a little stress on it, and it looks to be well secured and normal like it did on the MRI scan. So cartilage here looks pretty good, both above on the femoral condyle and below on the tibial plateau as well. As we slide over here to look in the central part of the knee, we'll see your anterior cruciate ligament. This is it right here. And it's running up in the right direction. Maybe a little bit lax in terms of tension, but I think that's just the way you're built at this point. But it does look like there's evidence of some prior injury here, doesn't it? So, still looks attached on the tibial side for the most part. But that's what we've got for your ACL. Your posterior cruciate ligament's on the left here, kind of behind the shaver, and it runs back in this direction here to the back of the knee. The ACL starts in the front and heads up laterally over here. Okay, so this lateral meniscus looks pretty good. This is the nicest looking lateral meniscus we've seen today. Doesn't look torn. A little bit of fraying back here posteriorly, but not too bad. A little bit of wear and tear changes on the cartilage. See down below how that's not quite as smooth as it used to be once upon a time. If we look up at the femoral condyle, this still looks pretty smooth. So that's not bad. Happy with that. We're going to go off on the video and look at the patella next. Okay, so we're looking up at the patella. Here's one little area kind of at the inferior pole that we've been exploring and examining just to see if this may be an area that we target. See that right there? And so we can certainly target that area with our injection. But the cartilage actually looks pretty good. Okay? This is the lateral facet over here, and that looks pretty good. The medial facet, not too bad. It's really more inferiorly that there may be an issue. The trochlea, which is what we're looking at down below, looks very good. Okay, I'm happy with that. Really no signs of any chondral or cartilage erosion there. So I'm going to look from the medial side to the lateral side. We'll go off on the video for a minute. So this is the look from medial to lateral looking at the patella. And let me get that shaver. From this vantage point, it looks good too. So we've seen it from a couple different angles. We've examined it with our best imaging, with our MRI scan. And as we look all the way over here, that's now looking lateral. That lateral facet looks pristine. It just looks perfect. Now, inferior is what we talked about a second ago. And as we back up a little bit, we can see that inferior is not in bad shape either. Try and pull the fat pad out of the way a little bit. And so that doesn't look too bad either. So I think this is going to turn into just a really good intra-articular bone marrow concentrate injection. I'm going to examine your knee one more time while I have you under anesthesia. That'll give me an even better idea of the stability of that ACL. But this sure looks pretty good. And so we're going to go off on the video. This will actually be the end of the video. And then we'll get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.